What is this about?
This is about the Affordable Care Act. We are asking Representative Bost to oppose repeal of the Affordable Care Act. It doesn't make sense to repeal it until we've all had a chance to look at what they're talking about replacing it with. Some of us would like to see single payer or something like that, but that's not going to happen in this administration. I took in over 260 letters from constituents of Representative Bost, in which he is saying what the Affordable Care Act has meant to them and asking him to oppose repeal. He's on the record of saying he does support repeal. One of the figures I've been using is the Illinois Health and Hospital Association has done some economic analysis, and they have said that
Illinois Health and Hospital Association said $11.6 billion to $13 billion economic impact to the state.
To the state, and 84,000 to 95,000 jobs. And the other point I'm making, I don't think I've said this to you, is the effect on coal miners, because one of the provisions of the Affordable Care Act makes it easier for coal miners to prove black lung and to get benefits under the federal black lung program, and a repeal of the ACA without doing something on that provision could leave many of our people in this district suffering from black lung without benefits. It would also hurt their survivors. There's something in the ACA that helps widows or widowers of coal miners. And then, I don't have any dramatic stories myself, but my children were able to stay on my health insurance until they were 26. And that was a tremendous help as they were trying to get established and get jobs that carried health insurance. One of my kids had ACL surgery on his knee when he was in high school. When he got out of college and the ACA was not in place yet, I tried to get him health insurance in Oregon, and I was told he was uninsurable because he had had ACL surgery. I talked to Blue Cross Blue Shield of Oregon, I talked to several other insurance companies, and they said, no, it's not just that we can exclude the leg or the knee, he can't be insured.
Because of that?
Because of that. And so another friend of mine, professional woman, law librarian, paid 30 years of insurance premiums. Her husband was diagnosed with ALS, Lou Gehrig's disease. Her insurance company dropped her. They were facing devastation, but the Affordable Care Act came in and they were not economically devastated. He did die, but at least the economic devastation was curtailed, and it was because of the Affordable Care Act.
So are there any solutions you have, you're offering? Is that what you're doing today? As they wrangle with it, any thoughts?
Well, I know a couple of problems with it. I mean, people talk about how high the premiums are. People talk about the decline of insurers participating. And there are real problems with that, and we ought to look at it. But I also know that there was supposed to be a fund to provide funds for insurance companies that had greater losses than they anticipated as they did the actuarial analysis of what they expected to have to pay out. And that was only funded by to 12.6% of what it was supposed to be funded by Congress, by the Republican Congress. So part of that is Congress didn't step up to do what the ACA said they were supposed to. In addition, just yesterday, a judge said that one reason Aetna pulled out of a lot of the markets it was involved in was because the Justice Department opposed its merger with Humana on antitrust gap, and the judge found that pulling out of some states, the market in some states, was retaliation